Said it's the only thing we know how to do. Work hard, play hard, work hard, play hard. We work hard, play hard, keep partying like it's your job. Work hard, play hard, work hard, play hard. We work hard, play hard.
Hi everybody, Jody Stokes with TGIGF, and today we're at Contact Physical Therapy with Ty Carlson. Very excited to be here.
Yeah.
Getting ready to get to know you.
Definitely.
And introducing physical therapy to God is Fit as well. Okay. So tell me a little bit about what your specialty is. I think you said you work with sports. What do you like best?
So I love sports. I grew up playing sports here in the Valley, but we like to do a lot of orthopedic type injuries here, overuse, sports injuries, post-surgical. I do a little bit of vestibular too, so kind of general orthopedic outpatient.
Okay, what do you see the most of around here? Do you see a lot of knee, back?
So back pain is very common,
Okay.
but seasonally what we see is generally people's exercise regimens change as the weather changes, and
Okay.
so if it's hot outside, sometimes people will move indoors, and maybe they're, instead of hiking, they're on the treadmill or the
Right.
Stairmaster,
Right.
and because the change of exercise, sometimes that causes somebody to not feel very good, causes an injury like that.
And they're just jumping into a different exercise because they think
Right.
they've been doing something else.
Right.
Okay.
Yeah.
And one thing I wanted to talk to you about too is because a lot of people won't engage in an activity because their knees hurt.
Sure.
And what do you suggest?
So if they're having issues with it, like you said, biomechanics play a big role in,
Yes.
in how people are feeling on the bike. So we want to
Right.
make sure that everything's, they're on the correct bike, everything,
Right.
the seat is sized correctly.
Right.
But then also to make sure that, they're not somebody who's using a certain muscle group more than another, where they're compensating with their quadriceps, for example, and excluding their gluteals or
Right.
whatnot. So it's kind of a case by case basis, but if you use the formula, you can kind of tend to figure out, all right, what do they specifically need personally.
Right. Tell me a little something. I've been hearing a little bit more about foam rollers and not using it for ITs.
I am. I personally,
okay.
I use foam rollers for ITs,
Okay.
and I'll really, anywhere that you want to use it, any muscles, I think it's a good idea.
Okay.
The IT band is very, very thick band of tissue, and it takes a lot of force to be able to deform it. And really what you're getting through with a foam roll is kind of the muscles around it relaxing.
Right.
You're not going to be really stretching that IT band itself at all.
Okay.
But if that foam roll, if you're relaxing the muscles around it so that way they're kind of, at a normal, comfortable state, then they're going to work more properly. And that's one of the reasons why foam rolling feels good,
Yes.
especially for exercise after.
But what if you're feeling pain?
So if you're feeling pain, pain is complicated. Sometimes it's pain because
We don't know if it's a
yeah.
muscle. I get it.
Yeah, you don't know if
exactly.
it's
Right.
okay, is it helping or is
Right,
it hurting?
right.
And so definitely that's something that I can help determine. But if it's something where it feels like it makes pain worse, then that's something where you want to seek an opinion, a professional opinion about
Absolutely.
that. Because then I can tell you, okay, yeah, is it bursitis? Is it just that the IT band is tight? Is it the muscles are sore? I can help you determine what's going on there.
Okay.
I like to think that pretty much everyone has what they need in their bodies. Their muscles do the same thing that the physio tape would do.
Okay.
It's like wearing, a brace, which can be appropriate at times, but then also, okay, well, what do we need to do to get you past the brace or
Right.
past the physio tape?
Right.
So, how can I get you to a point where you're feeling good and, through postural exercises, which is a really big thing.
Big thing. Yeah, I'm
So.
glad you mentioned that too, because that's important, because I think we're devolving, right? Computers,
Sure.
phones, everything else. Good. Ty Carlson, thank you so much. Come to Ty. We've got all of his information about Contact Physical Therapy. So glad we had an opportunity to talk with you. I'm going to work with him right after this segment on my shoulders and my back, and we appreciate you being here
I appreciate
today.
it, Jody.
Okay, and we will see you soon, and that's it. Be fit.
Said our hustle's work is never through. We making it 'cause we make it move. The only thing we know how to do. Said it's the only thing we know how to do. Work hard,